أعزائنا مشاهدي برنامج الدكتورة وأنا نرحب بكم في حلقة أخرى تأتيكم من مدينة شيكاغو في الولايات المتحدة الأمريكية لنناقش موضوع ومرض نفسي جديد مع أخصائية الطب النفسي الدكتورة جوليت دنخة. أحب أشكر الدكتورة لإتاحتها الفرصة لنا لتصوير هذه الحلقة في بيتها الجميل في مدينة شيكاغو. كما تعلمون هذه الحلقة تأتيكم عبر شبكة شميرام للإعلام، وتحية خاصة إلى الكاميرامان والمخرج هذه الحلقة الصديق الفنان الموهوب إلبرون باتروسي. Thank you إلبرون. You're doing such a wonderful job. Thank you. دكتورة، هواية جتينا أسئلة يقولون إنه البرنامج هو مقدم باللغة العربية، وحبوا بعض الناس إنه بعض الحلقات تكون باللغة الآشورية. طبعا إحنا مستقبلا راح نذيع أو راح نصور بعض الحلقات باللغة الآشورية طبعا، وكذلك باللغة الإنجليزية. موضوعنا اليوم هو أو المرض النفسي اللي راح نتطرق أو اللي راح نشرح عليه اليوم بهذه الحلقة هو مرض بلكي بنشوف الأعداد كلش متزايدة، وخصوصا عند بلكي الشباب أو الصغار بالعمر. فلذلك خلينا نبدي هذا المرض باللغة الإنجليزية حتى يوصل إلى أكبر فئة عمرية وحتى الكل يستفادون منه. طبعا اليوم احنا الموضوع اللي اختاريناه من ضمن سلسلة الأمراض النفسية هو ال ADHD. So what is ADHD?
So ADHD stands for Attention Deficit Hyperactive Disorder. It's a neurological disorder. I mean, it is part of psychological, but it's neurological because neurologically the brain, it's like divided in two ways. They know what to do, but they don't know how to do it, practice. So there's knowledge, there is performance. So when you have these kind of things, so we know that this person understands what they have to do, but they are lacking the performance part of it. And so attention deficit hyperactive disorder, it is known mostly in kids, but now we also know that it happens in adults.
Doctor, so the name in Arabic is اضطراب نقص الانتباه.
That's right, or الحركة الزايدة.
أو الحركة الزايدة المصاحبة للحركة الزايدة. How do I know if I have the ADHD?
You will know that you have ADHD when you feel that you're constantly distracted. But then حتى people will complain about you feel that your attention cannot last a certain time. You start a lot of projects and then these projects don't get done, like you have so many tabs in your head. Oftentimes there's procrastination. You feel like you don't get the things done because you don't feel like it. You get bored very easily, very messy. You feel that you're in your head a lot of times, thinking about things. They're impulsive. So you're talking to them and they'll say something that is not even part of the conversation. Their brain will jump from one thing to another that is not even related to what we're talking about.
So if I have the ADHD, is it noticeable to me for myself or to others, or both?
It could be both, but a lot of times people will notice it. People will say, well, you know, are you sure you don't have ADHD? You're sure because you tend to be distracted. You tend to constantly feel impulsive. You don't pay attention. Like your partner will say to you if they're older, and they're like, you know, you're not really listening to me. For kids, they're hyper. The teacher complains that they're not, they're not doing their work, their homework. They're always losing their homework. They'll get the homework done, but they'll forget to turn it in. مثلا, their book bag is always so messy. They lose things all the time. So
they lose, or they cannot find?
Oh, they lose them. They don't know where they put them. So they can put them somewhere because they're not paying attention where they put them, right? The other thing is you notice is like things that they do every day. Like you have to remind them to do it every day. Like it should be things that are routine, things that they know they should be doing. But you find yourself, like parents, find themselves constantly struggling to be able to remind this person to do this and to do that and to do that. They do lose track of time. That's why they get distracted. So they're not in the moment, and that's why a lot of times you'll see they're addicted to like their phone, or they play video games, because that allows them to be within the time, right? And then it kind of gets them excited. Most of the time they get bored. They'll start something and then they'll be bored. They don't want to continue it. Or they want to be able to do something else and something else. But then they're always excited about many things, but nothing in particular they will pursue per se.
So, Doctor, if I ask you, what are the three main signs of the ADHD?
So, inattention, impulsive. If you're talking about kids, right? So they're impulsive.
Let's focus on the adults, because I do have another questions about kids. So for adults.
Adults, the same thing. They're inattentive. They might not be hyperactivity. We see it more with kids, but they're constantly losing interest. You are talking to them and they act like they're really listening to you, but they're not. They're in their head. They're thinking about many other things. They get overwhelmed very quickly. They like I said, they don't finish projects, deadlines. They miss deadlines, even though they know that they have something to do, but they'll procrastinate. They won't get it done. And a lot of times, they'll get in trouble because the project is not done, or they'll be spending the last minute to get the project done. So as adults, even though before we used to think this is just a child disorder, because we used to see it in kids, their parents know it, that they're like distracted, hyper, ما أعرف شنو. Now they're realizing that adults feel like, they're like, you'll know them because they're like, when you're talking to them, they're not really there with you. And they can't sustain their attention with you that long. It's like a couple of minutes, max, especially if you're talking about a topic that they're not interested in.
Oh.
So if it's a topic they're not interested in, or a task they're not interested in, they do lose interest very quickly. And they can't get themselves motivated to be able to finish it.
Doctor, is the ADHD a very common disorder now?
It is common. It's like 30%, right? And maybe it's probably more common, but especially for adults, not a lot of adults, if they weren't diagnosed as kids, so they don't know that they have it, and they don't think that as adults they could have it. So a lot of times these adults, they didn't get diagnosed as kids, and maybe their symptoms didn't appear until they were adult. But because if they don't get evaluated and assessed, and if someone doesn't say to them, like a lot of times we confuse it with anxiety, like ADHD has some symptoms of anxiety.
That's what I wanted to ask too. Yes.
So because there's some symptoms that are matching anxiety, so sometimes they'll think it's really anxiety when it's really ADHD, and sometimes we really think it's ADHD when it's really anxiety. But of course, there's a difference between the two, right?
Doctor, at what age does the ADHD usually start?
Now, you could start as we don't diagnose until 7 years old in kids.
But this is the ADD, correct?
No, all of them, ADHD.
All of them.
Any of these like neurological kind of that has something to do with attention, we can diagnose it at age 7. So a lot of times these kids will wait till 7 or 8 to diagnose them, especially when they're having academic problem in school. So they're not doing well, they're not performing, their grades are falling. The teacher's complaining that they're constantly, moving in their chair. They're constantly asking the teacher, can I go to the bathroom? Because they're bored. They don't take notes very well because they're distracted. And therefore, hatta when they're studying for their exam, they don't study enough. They don't study enough because they can't sustain their attention that long to be able to study. So we have to use certain techniques with them. In therapy, they will learn techniques on how to be able to manage their ADHD. So kids, a lot of times they'll have the H, which is the hyperactivity. Sometimes you can have mixed. You have hyperactivity, but you also have inattention. Sometimes you have the attention, but you're impulsive, you're aggressive. You hear things that are not, that you're not understanding. So it makes you very confused very quickly, right? And and parents usually, or even partners, they constantly feel that this person is not motivated, that this person is lazy, that this person is not organized. So it causes a lot of problems between couple, especially you're talking to your partner, you're talking, and then you know that they're not really paying attention. So you think they're not interested in what you have to say. When really, it's like they cannot mechanically, in their brain, sustain their attention long enough to be able to hear what your story is. So the person feels injured and you didn't listen to me, you don't care about me,
Okay.
you know. You can't, every time that you talk about something and you think you understood it, they'll go do something different, and then you feel like they're disrespecting you. When really, it's just a neurological disorder. It's a disorder. And once we diagnose it, there are going to be medication, there's behavior modification techniques you can use with couples, with parents with their kids, with young adults that are in college. Once you get diagnosed, then maybe you'll know how to be able to manage these symptoms.
دكتور كيف يتم التشخيص؟
فالتشخيص لازم in English, yeah?
In English.
In English.
Why not? Yes.
So the best thing to do is if you feel or someone told you, look, there's something about your attention, you're not really paying attention, there's no clarity in your mind, you should go and get an evaluation. There's an ADHD evaluation that a psychologist or a psychiatrist can do to evaluate you and to be able to let you know if you have it. Once you're diagnosed and once we know it's anxiety, not ADHD, if it's ADHD really, it's the assessment, once you do it and you're diagnosed, then we know what to do.
So it's not a blood work or any...
No, actually, a lot of our disorders doesn't have a blood work. We do blood work because if you have other medical issues, it might affect your depression or anxiety. But with ADHD, there is no blood work. It's an assessment where we ask speed, we ask attention, memory. We ask these kind of neurological stuff to see: do you lose things? Are you bored easily? Do you feel that you're impulsive? Is your relationship with other people affected? Like at school, they have a very hard time maintaining friends because they're so impulsive, right? And they want to do what they want. Sometimes they can come across as very self-centered. Sometimes they don't have the attention to maintain a relationship. So a lot of times they might not even have long-term friendship.
Friendship, correct.
Because of this idea of like jumping from one thing to another. Plus, they, like in college kids, they might be even interested in doing drugs or alcohol because that calms them down. Like you'll see there's a correlation between people that have, or young adults that have ADHD and drug and marijuana use. Because it makes them focus. Remember, they don't have that focusedness. They want to focus, they don't know how to focus. So they don't like this about them. And so when they try marijuana, and marijuana kind of gives them clarity, they think this is the answer. But long-term marijuana makes you more hyper, more distracted anyways. So it doesn't solve the problem. But they're very much at risk of drug use.
Doctor, is the ADHD a mental illness?
Yes, it is. It's a neurological illness. So why we say neurological? Because في خلل في المخ. So there is مثل ما قلت من البداية, المخ, it's divided into two things. They know what they to do. So there's no problem with knowledge. So أنت لما تقعد وتقول مثلا, tell your partner, you're not listening to me, you don't know how to listen to me. They already know that. It's the ability to listen to you that is missing, right? So you give them lectures and you tell them you're not doing this for adults. حتى kids. نقعد ونعطيهم lecture ولازم تسوون وتعملون. Why you're not doing this?
No.
We give them lectures because we are so tired at how much energy they take from you because they have so much energy. So it sucks your energy out as a parent. It's physically you feel tired because they don't want to study. They don't want to do their chores. Their room is usually so disorganized. They don't want to follow rules. They're very, so and they're argumentative. They argue and argue.
Well, they are not because they are lazy, right? Because
No,
there's
it's
something
not,
in
it's
the
not
brain
a lazy.
causing this.
It's something in the brain that is not functioning. And that's why medication is important. Medication gives them that mechanism. So there's a mechanism in the brain that is not, مثلا, you and I are talking now. I have no problem with just concentrating on you. I'm not distracted by the camera مثلا, or of course I can hear my cat.
Yeah, that's what I was...
Yeah, I hear that, but I can focus on you.
Right.
ADHD can't. Everything, every movement, they cannot cancel it. right? So the medication helps this mechanism to be able to cancel. So when you're talking to them, they can actually pay attention to you. Medication for ADHD is very, very important. But you get these young adults and even adults that don't want to take it because they have this thing about, I don't want to get addicted to it. It has a lot of side effects. But in the meantime, they're not taking their medication, which means they're not focusing. They're argumentative. They're not listening. They're disorganized. They can't get their work done at work or at home. And you feel tired being with this person.
Is it always a long-term treatment for the ADHD or not?
Right, because you don't get, to be honest, no one ever like grows out of it. So sometimes
So it's an ongoing treatment.
it's an ongoing thing because again, it's a mechanism in the brain that's not working. So you will need to take medication. Now sometimes for kids, what we do is like in the summertime, during break, they don't have to take it. Although now science is saying they can take it. Before, we wanted to give kids a break because it used to be associated with their growth, right? But now it's not like that with the new medication. They can actually take it every day for a whole year. But some parents would rather not have them take it in the summer, but they're going to take a lot of your energy. They need exercising. They need to go and vent a lot of this energy. They do have a lot of energy. Even adults, they'll have a lot of energy. Uloya, let's go, let's do it. I'm excited. There's a lot of things. I want to start this project, and then they started, and then they're not interested anymore. You know, تحس إنه معاهم دائما you're on the edge. You know?
Doctora, can we fix the ADHD with, for example, like exercise, yoga, some of the drinks? I was just reading, like, online, it's like coffee, it helps. I'm not sure, like, if this is something right or not. But yoga, riyadha, does it help or not?
Part of it, yes, it can. Actually, exercise is very, very important for ADHD. They have to go exercise because this can also balance some of these hormonal imbalance. Yoga, it makes you concentrate, so it's hard for them because they have to really concentrate, and if they distract, it'd be very difficult. But anything to do with cardio stuff, basketball, soccer, anything that will vent them. The other thing is that they need these techniques. They have to write the list of what they need to do. It's very important. They always they will need you to help them also organize themselves. So it's very easy to be able to work on it. But does that replace medication? No. Now, some people might conflict with me because I'm not the one that wants medication for everything, but I do feel for ADHD, especially for children and young adults, it helps because it makes them focus in school so they can become better students. يعني أنا أحس فيهم حرام مرات. These kids, they're struggling and they're suffering and they can't concentrate and they really want to pass, and this is maybe their favorite class, but they can't do the math, they can't do the science, so they think it's something wrong with them. They don't know it's a mechanical problem. And then their parents refusing to give them medication. While during school, they really need to focus. They need to finish that project, right? They need to have a relationship with their friends. And even their social skills, it's low. Because they don't know how to talk to people. لأنه they're argumentative. بعدين فيهم فكرة إنه they're stubborn. فإذا عندهم فكرة, they will fight for that. They don't know how to give and take because they're so impulsive.
Doctor, how long it takes, like, to see good results on the patient?
I think if you exercise and if you take medication right away, you'll see the
with the
result.
medication, like how long it takes?
Yeah, probably about 7 to 10 days if the medication is right. Now we have different medications. There's some more popular than others, but sometimes like you'll take the medication and it's not really helping you focus. Sometime there are people that take the medication and do not like it because it makes your brain so focused. So if you're an artist, if you're an imaginary person, because ADHDs, they're very imaginary. They daydream a lot because, they disconnect, right? So they're disconnecting from their reality. So they're in their head a lot. So this medication, it will take away some of that creativity. So a lot of them, the creative ones, do not like to take the medication because they feel like their creativity is gone. They're numbed, right? They feel like, they're focused and they can do things, but they want to focus, but they also want their creativity.
So this is like one of the side effects then of the medicine, or?
It's not a side effect, it's the reality. Why are you taking it? You're taking it to focus. So when you focus, you're not going to daydream, because you daydream as a way because you're bored. صح? I mean, why do most kids daydream? Or why do even adults? I mean, why do you daydream? I'm sure you daydream. We all, because whenever we're talking about something, it's boring to us, or yani we can't focus, so we go in our head. So it takes away some of that. And some of these, creative people, they're like, no, but it takes away my creativity. I do need to daydream. This daydreaming or this detaching gives me ideas of other creative stuff. So, and sometimes it's like, a good healthy diet. Online they give you a lot of you can go to a nutritionist and they can put you on a diet where you can eliminate some of these substance in these food that can make you calmer, more focused. Exercise, learning how to do a to-do list, learning to use your time to tell you, okay, break now, 3 minutes. So you can do your job for 10 minutes, you need a break 3 minutes. Do your job another 10 minutes, 3 minutes. So there's a lot of apps there, they're ADHD apps, that can help you monitor your day-to-day activities. Yes.
Doctor, briefly, in a few words, if you want to learn about the ADD versus ADHD, what do you tell us?
Now, the only thing is different is that there's no age.
Okay.
For ADD,
so it's the age.
Here's the age. Well, ADD, a lot of times adults don't have that hyperactivity. Kids have
it's more
hyperactivity.
for the kids.
So you see it more for kids, شيطان احنا نقول. White shaitan. يعني he's has so much energy and he's climbing here and climbing here وما أعرف شنو. And then he gets punished a lot because he's never listening.
Correct.
So we always think that they're not listening to us. So, and why we don't do it a lot with adults, because we don't see that. I can have a conversation with you. It doesn't mean that you're really listening to me, and you could be already defocused or somewhere. You're not, but you still can sit and you can, For a lot of times, the age is not really associated with adults, unless they're a hyper adult, right? But most of the time is I can focus, I can sit in my chair, I don't have to get up and do it. بس عندي الهايبر مثلا أوقات ثانية عندي energy أبي أطلع الenergy, I want to finish, I want to do things. So that could also be part of this hyperactivity that I use in my day-to-day, I'm very active and hyper and
Doctor, نبي نصيحة, advice.
Well, advice إنه خاصة for kids.
Kids.
Or either one, if you feel that you match some of the symptoms I talked about, if you feel that you are distracted, your memory is bad, people are complaining that you're not listening, if you interrupt people all the time, if you have a lot of project and your boss is telling you that you're not finishing, you're not meeting deadline, if you're a kid and the parent is constantly being called at school, your kid did this, shaitan, he did this, he's not listening, he's constantly getting in trouble, get yourself or your kid evaluated. It's not going to hurt you. Get an evaluation, put them on whatever treatment you want, and let them live a normal life. When you leave them untreated, this kid is going to grow up feeling bad about himself because he thinks he's bad. Right? So a lot of them drop out of school. They don't go to college because they can't concentrate, so they think they're not smart, but they could be very smart, but they cannot perform what it needs to be performing to be able to get the project done or the class work done or the exam taken. For a lot of time, حتى بالexam, they have a very hard time. Exam ساعة, and they can only pay attention 10 minutes. Can you imagine? But we can train them on how to be able to maintain your ability to your attention on an exam. But a lot of times in schools, if they know you have ADHD, they will give you breaks. You don't have to take the test with everyone else. There's so much accommodation, especially
programs, correct.
بأمريكا اللي لاحظتها إنه there are programs made for, because it's a form of a disability, it's seen, and so you don't have to take it in the class. You can take it and give breaks. You can take it short. The teacher مثلا she can put you in front so you can pay attention. She gives you a small amount of information, not all of it at one time.
Correct.
She helps you be able to write your notes by writing it and having you write it. So there's so many things it can happen once your kid is diagnosed. And as an adult, you know your ADHD, right? You know that you don't have attention. You know that you get bored. So what you do is hopefully by now, you've learned to manage your symptoms, right? Or in an adult, take medication. What is wrong with taking medication? It's not addictive, as some people say, and it's not, the side effect is not what they think it is. So get evaluated. Find out what is the problem. Maybe it's not ADHD, maybe it's anxiety.
True.
Why don't we get it diagnosed? Like you complaining or I complaining, my stomach hurts, and I don't go to the doctor.
Mm-hmm.
So why complain about it and you're not doing something about it? So if I complain about my stomach, or I have a migraine, or I have a backache, I go to the doctor and find out why, so I can get it treated.
True.
And the earlier you guys do it, the better it is, especially with kids. The earlier you're realizing this kid, there's something about them. They're constantly, you'll see them, they're like in another planet. They're like in their own little world. So you're talking to them, and then you have to say, did you hear what I have to say? Did you hear me? Yeah. But they didn't. Or sometimes until you're talking and they're already defocused, but then you say something, catches their attention. What did you say to me? Please explain to me again, because they get confused. If you're noticing this with your kids, what's wrong with getting them evaluated?
Okay.
And nowadays you take them to a pediatrician.
Mm-hmm.
The pediatrician can evaluate also. So I hope people can seek the help that they need.
دكتورة حلقة ناجحة أخرى. Thank you so
Thank
very
you.
much for your time, for your support, وكل المعلومات الانفورميشن القيمة اللي تعطينا إياها خلال برنامج الدكتورة وأنا.
Shukran jazeeran. I hope that it really helps, and
Thank you.
I hope people really, really will benefit.
Thank you so much.
Thank you.
High five.
High five.